Hi, today we are going to discuss about transposition of great arteries. So it is a type of cyanotic heart disease. Now normally right ventricle opens into pulmonary artery and left ventricle opens into aorta. But in transposition of great arteries, right ventricle opens into aorta and left ventricle opens into pulmonary artery. So what you can see in this diagram is, this is your right atrium, this is your right ventricle, this is aorta, left atrium, left ventricle, and this opens into pulmonary artery. So this is what is happening in your transposition of great arteries. Children with transposition of great arteries, they require atrial septal defect and ventricular septal defect. Now first we will discuss why they require atrial septal defect, in what way it is going to be helpful. So let us suppose that this is the schematic diagram where the heart right and the left half is shown. So this is your right atrium, right ventricle and left ventricle. I told you in transposition of great arteries, right ventricle opens into aorta and left ventricle opens into pulmonary artery. Now when there is atrial septal defect, you know that the pressure in the left atrium is going to be little higher than the pressure in the right atrium. So therefore, blood from the left atrium, that is the oxygenated blood from left atrium, will move towards right atrium. From right atrium it will move towards the right ventricle, and from right ventricle through aorta it will reach the general circulation. So therefore there will be some amount of oxygenated blood. So therefore this is going to help in giving some amount of oxygenated blood to the body. Now let us discuss what happens with ventricular septal defect. Now let us suppose again this is your heart with your right atrium, left atrium, and here there is atrial septal defect also. Here you are going to have right ventricle, left ventricle. This opens into aorta and your left ventricle opens into pulmonary artery. Now when there is going to be ventricular septal defect, what is going to happen? Now normally the blood is getting shunted from the high pressure area to low pressure area, and whichever ventricle opens into aorta, it is that ventricle which is going to have higher pressure. So therefore in this case, because right ventricle is opening into aorta, right ventricle is going to have high pressure. So therefore from right ventricle the blood is going to be shunted into left ventricle. From left ventricle it goes to pulmonary artery, and here it goes to lungs where it gets oxygenated, and once it is oxygenated it is going to enter into the left atrium through the pulmonary veins, and from left atrium there is atrial septal defect already. So in this case, along with the oxygenated blood which is being shunted from the atrial septal defect, there is also oxygenated blood which is shunted because of your ventricular septal defect. So in this case the oxygenated blood is going to increase. So therefore having ventricular septal defect along with atrial septal defect in people with transposition of great arteries is going to be of help. Now what happens in the child if the ventricular septum is going to be intact? If the ventricular septum is going to be intact, then the amount of oxygenated blood they are going to get is only dependent on atrial septal defect. So which means the oxygenation is going to be less. So therefore children with ventricular septum which is intact, they are going to have hypoxia soon after birth. They are going to have hypoxia soon after birth, and they also develop cyanosis very soon, and they can develop congestive heart failure. So ECG in these children will show you right axis deviation and right ventricular hypertrophy. When you talk about chest x-ray, it is going to show cardiomegaly. It is going to show cardiomegaly. And this cardiac borders are going to be seen as egg-on side appearance. This is a very important MCQ. So which of the following shows egg-on side appearance? So it is a very important MCQ. Now what happens to people with ventricular septal defect? Now people with ventricular septal defect, they will have very good mixing, but they can also develop congestive heart failure. Now what you can see in ECG in these patients are, you can see biventricular hypertrophy along with right axis deviation. And when you talk about chest x-ray, you can see the plethoric lung fields, and you can also see plethoric lung fields and pulmonary venous hypertension. Why? Because blood is shunted from right ventricle to left ventricle, then to pulmonary artery, lungs and pulmonary veins. So therefore there can be pulmonary venous hypertension. So how can you treat these patients? So basically treatment is going to involve, the first one is prostaglandin E1. So this prostaglandin E1 helps in keeping the ductus arteriosus patent. So therefore cyanosis is reduced to an extent. The second one is going to be balloon atrial septostomy. So balloon atrial septostomy. So this also helps in increasing the mixing between the atria. But the most important definitive surgery is going to be arterial switch operation. So it is going to be arterial switch operation. Now what you're going to do in arterial switch operation is you're going to resect the pulmonary artery and the aorta. So pulmonary artery and aorta are resected. And distal aorta is anastomosed to proximal pulmonary stump, and pulmonary artery is anastomosed to the proximal aortic stump. But this surgery has to be done within 2 to 4 weeks after birth. So why it has to be done within 2 to 4 weeks after birth? Because when the left ventricle is going to open into pulmonary artery, because of the reduced pulmonary artery pressure, your left ventricle will start to regress. So therefore, only if this surgery is done in 1 to 2 months of life, then the left ventricle can adapt to the change in the major vessel, which is aorta, which is getting linked to this left ventricle. So therefore, in order to the left ventricle for getting adapted, the surgery has to be done within first 2 months of birth. Now if suppose the surgery is not done in the first 2 months of birth, the last option is going to be atrial switch operation. The problem with atrial switch operation is that patients who are undergoing this surgery, they can have arrhythmias and they can have conduction defects. So therefore this is not recommended. Basically this is not recommended. Alright. Now whatever you are treating with, what should happen to your patent ductus arteriosus, what should happen to your ventricular septal defect, should these be kept intact or this also should be operated? So basically it is advised to operate this also, because in the long run your pulmonary artery pressure, which is going to increase, is going to cause obstructive disease and the person can develop heart failure. So therefore it is better to close this ventricular septal defect and the atrial septal defect or the ductus arteriosus also. So this completes discussion on transposition of great arteries.